We are here at the B20 Summit, and joining me now from the United States of America, I'd like to welcome Dr. Mary Showstark. She's the Chief Liaison Officer for Healthtech Without Borders. So, we're going to get an understanding on how this organization assists medical personnel throughout the globe. Dr. Showstark, thank you so much for joining us here.
Thank you so much for having me.
Okay, Dr. Showstark, discuss what is Healthtech Without Borders. So I'm assuming it's health sector, the tech sector collaborating together.
Absolutely. Healthtech Without Borders is a nonprofit organization. We're all volunteers at the organization, actually. And we bring technology to disaster zones and conflict zones all over the world for humanitarian aid. We are tech agnostic, and we essentially bring technology into these countries for access to care and digital health tools.
Dr. Showstark, there are conflicts around the world. How are you assisting with regards to that? Because you were telling me before we started, there are virtual sort of discussions that happen because there are far to reach areas, especially in many of the areas where violence has become so bad that it's difficult to have that connection. Talk to us about that.
Yes, no, absolutely. There's too many conflicts in this world today, and increasing amount of disasters that are happening in this world, from hurricanes to fires. And the conflicts that are happening, we actually started Healthtech Without Borders. The founders, and I'm not one of the founders, I'm a chief liaison officer, but our founders started this because of the Ukraine-Russia war, and they wanted to be able to help and give access to care. So we've seen over 200,000 patients through telemedicine currently with Doctor Online and several of the local telemedicine providers. So what we do is we support with the technology, we support with the doctors, we support with educational materials. We've also set up 5 hospitals in the Dnipro region with technology and tools and devices that are able to help them get and give access to care, because the roads are actively being bombed, and so they're not able to come to the hospital, and patients are not being able to be seen or have their rehab treatments. We are tech agnostic, so we work with many different tech companies, and that's actually why I'm here at B20, is to learn about the different teams and who is here and what technology is available and how they can interact and support with these disasters and conflict zones all over the world.
Yeah, I want to ask, because it's the B20 within South Africa. How have you analyzed the B20, number one, and number two, just how much opportunity exists within the African continent?
Oh, the African continent is absolutely fantastic, because half of the population is under I think 20 years old here on the continent. Don't quote me on my statistic there, but it is absolutely impressive, the amount of technology. I am friends with Sand Technology, and they have created. Fred Swanaker is from Ghana, lives currently in New York City, and he has created ALX and ALU, which is training coders and programmers across the continent of Africa. And they have helped us and supported us on initiatives that we've done in Cameroon with regards to telemedicine, and lots of different initiatives. So Fred was one of the keynote speakers on stage today, and it was wonderful being able to see him and reconnect with him as well here. So there is an amazing, enormous amount of big tech and developments that are here happening right now in Africa, which is really exciting.
Dr. Showstark, I'm going to throw a bit of a curveball to you, right? The president that, of course, represents your country, US President Donald Trump, is not attending the G20 Leaders Summit. But you know who's here? American business individuals like yourself, who of course are from the United States of America. To my view, there seems to be a stark contrast in how citizens, business individuals from the United States see things from what we are seeing in Washington. I had to get your comment on that, because I just see that stark contrast, and I'm thinking, well, this is not really a representation of what US President Donald Trump is saying with regards to South Africa and the way we conduct ourselves. I'm not going to get into the politics of this, but it's just interesting to hear from a United States citizen with regards to this.
Yes, I try to stay pretty politically neutral in my interviews and my comments, and I think I've personally been to 127 countries, and I'm about to go and travel into West Africa and explore a few more countries as well, and meet with some of the medical and digital technology teams that are in across West Africa. For me, I can speak for myself, and I'm a person who likes to learn. I'm very curious, and I believe in exploring and connecting and and really becoming a global citizen. So I will continue, despite if our president doesn't come to the country. I used to live here in Johannesburg back in 2006, 2007. So I have a fondness for Johannesburg in my heart. And I did some training at Johannesburg General Hospital here. So, and they had a reciprocal rotation with our teams in University of Miami and University of Florida. So I'm super thankful to be back in Johannesburg and in South Africa. Though our president is not here, I am here, and not that that makes up for it. But
No, well, I mean, listen, you know what? As long as there is representation from the United States, I think we are happy because we need global inclusive growth. I know you're not Catherine Levitt, who's the White House spokesperson, so we're not going to ask you any more political questions in that. But I must say, how have you found South Africa's B20 leadership in terms of assisting from a health perspective and a tech perspective? Because the message that's coming from President Ramaphosa is that there has to be that bridge that gets closed for the global north and the global south to have business being done in a fair way. What is your take on that, Dr. Showstark?
I think it's absolutely necessary, and that's, with Healthtech Without Borders, that's why we are all over the world, and we are doing this in a global, inclusive manner. And health is part of human security, and human security is health. And so when you see all these, we've worked with tech companies. We built a chatbot with Microsoft, and Microsoft helped us build a chatbot that teaches Stop the Bleed and how to combat casualty care. So we've deployed that in Sudan so that civilians and medical providers can really be able to assist with the tragedies that are happening there. We've also deployed that in Ukraine. So I think all of these global efforts are absolutely necessary, with the collaboration of NGOs, public-private partnerships, and governments, so that we can continue to help our citizens around the world, no matter what country or ethnicity or race or who we are, but just to unite all as one.
One final question, Dr. Showstark. The future of the work that you do, assisting medical personnel from a virtual perspective. Obviously, it's about getting the medication, it's about getting the healthcare facilities to the ground where the war-torn areas are happening, where disaster areas are happening. How do you see this happening, and what would be your recommendation to those with deep pockets to assist with regards to this?
That's a great question. I think it's really, we're in the process of building a disaster application right now, and that disaster application is going to connect NGOs, governments, public-private partnerships, churches, people who are working on the ground. And that is one of the projects that we're working on. And I think it's fundamental because in this day and age, I'm on 16 group WhatsApp chats where I've just come back from working on the ground in Jamaica, and I was helicoptering village to village, and we were providing rapid needs assessments with Medicorps and third wave volunteers as well, our NGO collaborators. And where we were doing this, people are not getting access to care. We're delivering the Starlink technology so now that they can get access to care. In Jamaica, being on all of these group chats, people need water, people need different supply chains. And so what we're doing is trying to merge this all into an application that's open to everybody, so that people can get access to care in a disaster and know who's on the ground, know where the supply chain is, know that there isn't duplication of efforts. When I worked in Haiti, we had supplies delivered onto the ground into the tarmac, and there was no one receiving those supplies. So it's all about collaboration, connection, togetherness, and when we work together, we are stronger together.
Dr. Mary Showstark, absolute pleasure having you, and thank you so much for joining us.
Thank you so much for having me.
And that concludes the B20 summit here on Mzansi Welcomes the World. We'd like to thank you, the viewer, for staying with us here on Hilaal TV, DSTV channel 347. A special thanks to my camera operator, Ellen Chuma, for making this possible. And we will see you at the G20 Leaders Summit. Assalamu alaikum wa rahmatullahi wa barakatuh.